the evidence was clear for a very long time, but they just didn't want to believe that that their kid was doing it. They wanted to believe that I had stopped, that I was no longer doing it. You know, there were times where I would tell them, you know, yeah, I'm doing drugs, but I'm stopping now, like I'm not doing it anymore. And they didn't know how addiction worked or enough about drugs beyond what you normally hear from, you know, the usual places, you know, the government ads, the teachers, and, you know, the normal stuff. So they didn't really know what to expect next or what to do about it.
27-year-old Bill Patrianakos is working with the Robert Crown Center for Health Education to help educate parents, teachers, and students about the dangers of heroin. In high school, Bill experimented with heroin, admitting he was self-medicating, trying to escape the pain of an undiagnosed depression. Now, as a recovering addict, he realizes he didn't process cause and effect the way he does now. And Bill's not alone. Medical experts now know the teenage brain functions differently than an adult brain because the frontal cortex is not fully developed. This section of the brain controls human decision-making. Researchers believe this decision-making function isn't fully formed until after age 25. Teens aren't well equipped to adequately assess the risks they're taking, like those that come with the use of highly addictive drugs. Health educator Dr. David Bedney acknowledges that understanding teen brain development can help parents guide their students and encourage positive versus negative risk-taking.
Everything they're going through in childhood is leading them to become adults productive in society. And as they receive positive feedback, as they receive encouragement because their choices are good, as they start a project and they take that project to completion and someone comes and says, wow, that's a great thing that you just did, that is making them say, wait a minute, that was good, maybe I can make better choices in the future as well.
So it's important to understand if a child is more of a risk taker, that we need to make sure that they understand that there are good risks. Try new food, try new friends, if you move to a new place, try new sports, those are good risks. But there also are bad risks, and things like experimenting with drugs and alcohol are things that should not be considered a good risk.
Research by the Robert Crown Center for Health Education reveals that young people are especially at risk of substance abuse during periods of change, including transitions, moving from middle school to high school or high school to college. When there are changes in their social circles or relationships, including breakups, friends changing or moving away, or through transitions in their activities, making a team, not making a team, pressures to perform increasing. Opening and maintaining a healthy dialogue about substance abuse in the family is a proven factor in reducing the likelihood of abuse.
Science tells us that teenagers have less risk of making unhealthy choices if they have a good support network and if they have a good communication mechanism with their parents or other adults that are important to them. Because teenagers do have a lot of questions and they really don't know the answers, and it is important to be able to discuss these very important issues with someone who cares about them and who understands that they are teenagers.
That's what the kids were looking for. What do my parents think? What do my parents think about what I'm about to do? And that would help them make their decision more than anything else. The most influential aspect or effect was from the parent. Parents don't realize that, but they have a greater influence on their kids than they know.
Though they may not ask for advice, teenagers can feel overwhelmed with stress, which is the perfect opportunity for parents to help their teens explore effective coping mechanisms.
Life is not as bad as they think it is, but sometimes my perception is real. I hate my life. I just wish I didn't have it this way. Well, if I can escape for a few minutes, I'll feel better about it. I think I'll feel better about it. But what happens after that drug is used? I come back to reality. I've got to face my problems again. Coping skills, they don't have them yet. Again, that goes back to those relationships. That goes back to those parental relationships that they listen to so much. We've got to teach our kids about coping skills, and it's going to take a while. It's not something that happens overnight. It's something that's going to take a while to teach them coping skills, decision-making skills, techniques, so that they can understand a little bit more about how to cope with difficulties when they find themselves in a difficult situation.
Medical experts say it's important for parents to have conversations with their teenagers about the effects of drugs, including heroin. As hard as it may be for the parent to start the conversation, the outcome can alter how their teenager deals with peer pressure.
And I know that it's uncomfortable to do these sorts of things, and it's hard to not get upset when your child talks about these things, but if you can listen to your child and try to steer them in the right direction without being judgmental or getting angry when you hear these things that you don't like, and try to calmly instill some sense in them, I think that will go a long way.
This video was funded in part by a social services grant from the City of Naperville and partially sponsored by Walgreens. Produced in partnership with Rush University Medical Center and the Center for Compulsive Behavior and Addiction.